In today's video, you're going to learn how to step backwards, especially if you have a stiff or a spastic leg. If you're new to this channel, I'm Tara, I'm a neurologic physical therapist, and on this channel we talk about anything and everything related to mobility, health, fitness, and mindset with the end goal of empowering you with as many tools as possible to take ownership of your rehab and your health, to live an overall more active, more mobile, pain-free, happier, healthier life. And all that said, we're going to go over an extremely common problem, and that is how to step backwards, especially if your leg is very stiff. This is an extremely common problem, and it's an invaluable skill to have to decrease your risk of falling. In case you lose your balance backwards, you need to be able to step backwards, but also functionally in everyday life, being able to open a door, you have to be able to step backwards, step out of a closet, pull something off of a shelf. It's just a really valuable skill. So today we're going to go over how to do that. So let's go over some of the reasons why you might not be able to do it if you have a stiff or a spastic leg. One is that you can't bend your knee, which most of you know. If you have a stiff leg, your knee always likes to lock out. So if you can't bend your knee, you can't clear the ground to get that foot backwards. Most of you get around that by just kind of rotating your body. That's one reason why most people, or a lot of people, can't step backwards with a stiff leg. The other reason is you can't dissociate. So dissociation is when you can separate the left side of the body from the right side of the body. Sometimes after a brain injury that involves one side of the brain, you lose that ability to separate the right and the left side of the body. So why is that a problem? Well, you have to stand on one leg, meaning you have to keep one leg straight when you step your opposite leg backwards. And for many, many people, that inability to dissociate is what prevents you from being able to bend that knee to step that foot backwards. And then there's kind of a third category, which I would call people that just can't coordinate the right muscles at the right time. So what are the muscle groups that need to coordinate? Hip extension with knee flexion. Those two movements together, groups of muscles together, need to be able to work together. But all that out of the way, let's go ahead and dive into the exercises to address those issues that we just talked about to improve your ability or your chances of being able to step backwards. Okay, so step one is that knee flexion we talked about, being able to bend that knee. We call this a passive movement. It's kind of what we call like a bottom-up approach. Remember, there's bottom-up activities going on, and there's top-down activities that need to go on, and both are necessary in order to restore a normal automatic movement pattern where you don't have to think about it. This is passive knee flexion, so this is kind of what we call like a bottom-up component of the relearning process, and you just want to hold it. Learning how to relax this leg. We're not active yet. We're learning how to passively relax this leg. The other thing it does is it ensures you have the mobility, you have the range of motion to get that leg back. Once you can do it on a small step, the next step would be to go to a slightly bigger step. And again, step down. This is your involved leg. If you can't do it on that step, do not go any higher than that. But again, we're still working on that passive component of passively flexing that knee. Now, I want you to hold this position. And the reason for that is now we're getting into that dissociation as well. So separating the left side of the body from the right side. If you get into this position, you feel like this leg is going to buckle, or this leg's really pushing down hard into that step because it's trying to straighten out because this leg is straight. You kind of want to safely stay in the position, figure out, extend, push on this leg, and relax this leg. They have to do opposite things. Left leg has to be straight, or your uninvolved leg has to be straight. You have to get this leg to relax. So a lot of times what I see is this leg is really pushing in hard to into that step, and it's because this leg your brain knows this leg needs to stay straight to keep you from falling. And so this leg is trying to straighten out. You just kind of want to have to try and work through all of that until this leg relaxes. So that's kind of that dissociation component that I talked about earlier. All right, and then lastly, I talked about being able to coordinate the right muscles at the right time. I love, love, love a skateboard. Setting your foot on a skateboard, you can work on gently pushing that leg backwards but it's easier because you have your foot on something with wheels on it, so you can really focus on just that hip extension, trying not to let that leg lock all the way out. So you want to stop just short of that. So you're working on that hip extension, but remember I said it's hip extension with knee flexion, so you want to be able to allow that knee to stay bent. And then the last little tool or tip I would give for stepping backwards to coordinate is this resistance band belt. Absolutely love it. This is where you're combining that bottom up with top down. You're making it easier, or you're getting some of that passiveness, right? That bottom up of that band pulling your leg up, but you still, it's not going to do it perfectly. It's just assisting. You still need that top down, meaning you still need to direct the motion of your leg, getting that foot back. It's both are important for learning any new skill. You need some bottom up strategies. You need some top down strategies. This resistance band belt is a great way of combining both, coordinating that hip flexion, knee flexion with hip extension, in that top down of kind of directing that motion. Okay, and then that is it for this video. I hope you guys found this video helpful. If you did, and you want to get more videos like this, go ahead and hit that subscribe button, turn on that notification bell so that you will get notified every time I upload new videos. I enjoyed spending time with you all today, and I'll see you in the next video. Have a good day.